Hello, everyone, and welcome to this audio podcast. And in this audio podcast series, the SI Loci Equinox. This is an audio podcast where there's RPSG and KDOS collaborative alongside Storm Robotics production. As an audio podcast in the as part of the Ballistix, as part of the Ballistix edition. This is the Shientist, and this will be an audio podcast around in and around hydronephrosis. So to begin with, hydronephrosis, it can be classified based on based on generally where there's an obstruction obstructive where there's obstruction and sort of non-obstructive causes in relating to in and around the sort of renal tubules and tract. In this condition, specifically the urine collecting system surrounding the tubules can be compromised. So dilation and swelling of the renal tubules there's dilation and swelling of renal tubules owing to a buildup of urine. Urine, for example, and it's a common characteristic issue surrounding this particular disorder. Hydronephrosis can occur, can form or can be part of across sort of both sides on both sides of the on both sides of the renal tubules. So in sort of in regards to this, there can be bilateral. There's when on both sides it's bilateral, sort of bilateral cause and process of hydronephrosis can be sort of can be physiological and then sort of where the renal tissues are affected further. It can be pathological as well. Urine generally cannot drain out from the renal tubules owing to blockage or an obstruction in and around primarily the renal tubules, but also where the bladder is affected. The result is sort of a decreased glomerular filtration rate, and decreased sort of a decreased renal blood flow, and also where there can be nephron degrading as well. Hydronephrosis may also lead to pyenephrosis caused by stasis of urine in presence of the upper tract. So some of the risk factors can include, for example, where there's renal stones or sort of commonly known as kidney stones. There can be congenital excuse me. There can be congenital bases as well. For example, a sort of a blockage or a defect that is that occurs or is present sort of from birth. There can be blood clot formation around the genitalia as well, as one of the risk factors. Scarring around the tissue. So, for example, where from injury or previous surgery, there can be tumor or cancer as a risk factor. Enlarged prostate in those from the male background, and pregnancy can be risk factors risk factors to propagate sort of hydronephrosis symptoms or as a risk factor as well. Urinary tract infection or UTI or other diseases that can cause inflammation primarily around the tract or urinary tract are all sort of bases for risk factors. So the causes, some of the causes, so there are obstructive and non-obstructive causes alongside sort of the risk factors, and this sort of table here in this slide sort of highlights those and these causes, obstructive and sort of non-obstructive causes, are sort of addition to the risk factors and alongside where there may be a compromised renal parenchyma. In context of classification, there can be there are several sort of bases. So there's specific causes, there's specific levels of that classification. Then there's specific there's a specific sort of bases as in the particular area of pathology and tract and tubules that are affected. Then there's the extent of where of obstruction and where that stems, and then also the depth, for example, as well. So in a random classification, there's cause, there's causes, there's level, then there's again there's sort of unilateral and bilateral, there's complete or partial, and intrinsic or extrinsic as a sort of a basis around this. In particular, sort of bilateral hydronephrosis can be problematic. So it can remain a problem in men secondary to benign prostatic hyperplasia, for example. It can develop in high pressure retention as maintenance of voiding with a high bladder volume. Voiding spontaneously and often where there's little or no sensation of incomplete bladder emptying because of gross distension in and around the bladder. In females, pregnancy can be a physiological cause of hydronephrosis, and the mechanism is generally related to high levels of circulating progesterone during pregnancy. During pregnancy as well, about 90% of women will have some bases of calyces, renal pelvis, and proximal ureters, where hydronephrosis can be probable. The pathophysiology around hydronephrosis includes where there's anatomic and/or functional processes which again interrupt the flow of urine as part of the renal tract, or as part of the renal tract. Fluid can can back up into the renal tubule. So in part of the pathophysiology, a little bit in relating to VUR, the pathophysiology around hydronephrosis can also occur in relating to where there's sort of fluid reflux back into renal tubules, and there is a rise in pressure causing stretching and dilatation of the renal pelvis, and if pressure continues to rise, then this leads to a decline in renal blood flow and glomerular filtration rate as well. And if significant obstruction is persistent, and then it affects nephrogenic tissue and results in varying degrees of cystic dysplasia and also renal insufficiency or renal impairment. So part of the diagnosis can include abdominal examination and a focused history looking for surgical scars, organomegaly, and masses. It's important to identify renal physiology for nephromegaly and or enlarged bladder. Important to measure sort of arterial blood pressure in and around where blood flow to and from the renal pathophysiology could be compromised in some way. It's important to examine for signs of fluid retention and fluid overload. Urine dipstick and midstream urine investigations are important, but also next to useless if on their own and on their own will not identify or diagnose hydronephrosis. Ultrasound is sort of a modality for early detection of sort of obstructive hydronephrosis and can allow to evaluate the renal around the renal physiology and collecting systems. Radiology also extending to computerized tomography or CT and magnetic resonance imaging or MRI, and intravenous urography can also be implemented and also can be helpful. Renograms can be useful. So literature has highlighted mercaptoacetyl triglycerin sort of renogram has been used to identify obstruction of the ureters and blood and urine investigations in specifically again serum creatinine, identifying the serum creatinine levels and urine and electrolytes can allow sort of a sort of underpinning sort of basis around diagnosis alongside other sort of pathophysiological investigations for hydronephrosis. So as part of the sort of symptomology, there can be flank pain where there's a character of this sort of pain that varies depending on whether the obstruction is acute or chronic and or partial or complete in context and relating to hydronephrosis, and also abdominal where there's abdominal mass, nausea and vomiting, increased sort of urinary sort of urgency, where there's also evidence of a sort of tract infection, and where there can be evidence of dysuria, and also sort of for example where there can be sort of alongside excuse me alongside sort of abdominal mass that can then also relate to sort of pain in and around the sort of the peritoneum area, which can then can relate to inflammation around the peritoneum, which then is or can be a result of infection referred to as peritonitis. So according to Granger and Allison's sort of diagnostic radiology, hydronephrosis has several sort of gradings. So grading 1 to 4. Grading 1, for example, there can be slight blunting of calciophoreses. Grade 2, there can be blunting and enlargement of calciophoreses, but easily shadowed but easily sort of seen and shadowed, easily seen in some parts of grade 2 investigations, but can also be shadowed by papillae. In grade 3, there can be a sort of a rounding of calyces with sort of obliteration of papillae. And grade 4, there can be extreme sort of calyceal sort of ballooning, where hydronephrosis can cause more sort of parenchymal, renal parenchymal, and sort of tract parenchymal damage. The management, if you like, around hydronephrosis can include where the duration of the area and obstruction should generally guide the management. So generally, where specialists between, for example, nephrology and urology are concerned, generally on viewing sort of the obstruction, the management around the hydronephrosis is more becomes more sort of becomes more of a sort of basis alongside other aspects in relating to particular guidelines. And it generally is essential to treat any sort of coexisting sepsis if sepsis exists, alongside any metabolic disturbance. Of course, it's important to remove the hydronephrosis, and where there is obstruction, and dilatation where urine obstruction exists, and there's sort of evidence around the accumulation around the obstruction, and also where appropriate antibiotics can be used to prevent some of the symptoms. For example, any urinary tract infections, for example. However, hydronephrosis is and should be approached generally through sort of urology, through a urology basis. So the summary around this is that any sort of benign sort of prostatic hyperplasia and ureteric stones can be common causes of sort of bilateral and unilateral hydronephrosis. Where hydronephrosis in relating to sort of pregnancy can be a physiological cause driven by high levels of circulating progesterone. Compelling indications for urgent treatment of hydronephrosis would be a case of severe ipsilateral flank pain acute kidney injury, and signs of sepsis. Investigations with suitable imaging are often required before an appropriate management can be sort of identified. Can be identified.